Now femur. Femur is the longest and the strongest bone in the body. Okay, it is vertically placed with some angle because of the pelvis here. Now it has three parts: upper end, lower end, and the shaft. The upper end is further divided into many structures like head. You see very smooth area of the head. Let's identify the parts and I can demonstrate the features. Head,
neck.
then we have neck, then we have greater trochanter, then we have lesser trochanter, then we have anterior intertrochanteric line, not very obvious, but we have a very obvious crest on the back, and posterior intertrochanteric crest. All this green I made.
Where is the crest of that?
Here is the line, which is not very obvious, but this thick part, this thick part is the crest. So we have posteriorly crest. Connecting the two greater and lesser trochanters, we have crest. Good? So, okay. Then after the lower end, we have two condyles. We have an intercondylar notch. How to find the anatomical position, right or left especially? This is the anatomical position vertically, and right and left can be done by keeping the head on the medial side, keeping the bone vertical, and keeping this notch on the back posteriorly. If you make it like this, it will be your right-sided bone. It's now for me it's right-sided, so it is a right-sided bone. Clear?
Yes.
Now let's describe the parts. Head, well-rounded head, spherical. It has a fovea. This is called fovea. Fovea centralis. Fovea. Fovea has a ligament attached here. The ligament has a blood vessel to supply this part of the head. It will of course anastomose with some branches from here, some branches from here. All the surfaces from medial and lateral circumflex vessels, they will give branches, and some other branches. They will anastomose, but still the anastomosis is not in a great shape. Once there is a fracture of the neck, that creates a problem and leads to a condition ischemic necrosis of head of the femur. If in a young person where we have an epiphyseal plate between the head and the greater trochanter here, and if we have a dislocation or damage to even ligamentum teres or ligament of the head, still it can give you ischemic necrosis. Understand the point? Either the fracture or a separation of the epiphyseal plate with a damage to this part can give you ischemic necrosis. The head will lose its shape. It will be associated with pain and some difficult movements and different features. This ligament is attached, one side it's here, the other side is with the ligament is now coming from here. See here. Okay. So from here it will go and attach to the transverse acetabular ligament. And that is the area from where the blood vessel will enter and reach here. One of the branches of obturator. Head. Then we have neck. The shaft and neck angle. Here, shaft and neck angle is roughly 125 degrees like here. It is less in females because the pelvis is bigger and broader. Neck has anterior surface and a posterior surface. It has a greater trochanter on the back here. It has a lesser trochanter. Here is the trochanteric fossa.
Can we see it here?
Yes, trochanteric fossa. This trochanteric fossa.
Where is that picture?
Trochanteric fossa. This one. Here. This is trochanteric fossa. Good. This is trochanteric fossa. Greater trochanter, apex of the greater trochanter. Then we have anterior border, posterior border, superior border, and the apex, and a lateral surface. Anteriorly we have a line which is not very obvious, but still we can feel it in real bones. Anterior intertrochanteric line. Posterior we have intertrochanteric crest. At the junction of upper 1/3 and lower 2/3, we have an elevation known as tubercle, quadrate tubercle. Quadrate tubercle. Then we have shaft. Shaft has good borders only in the middle 1/3. So posterior border, which is actually the linea aspera. Then we have medial border. Then we have lateral border. In the middle, it's very obvious. But in the upper and lower part, the borders are not very obvious. So we classify them into surfaces. So anterior surface, posterior surface, medial surface, and lateral surface. Similarly, on the lower end, we have anterior surface, medial surface, lateral surface, and here we call posterior, better say popliteal surface, because this is the area of popliteal fossa now. Okay, so popliteal surface. This midline, the obvious one is known as linea aspera. It's all linea aspera. It has two lips here, medial and lateral, medial and lateral. Here, not very obvious, but here they separate and make a triangular area known as popliteal surface of the femur. Similarly, we have popliteal surface of the tibia, and this will contribute in the formation of popliteal fossa. Then we have two condyles. The lower end is divided into two condyles. We have medial condyle, which looks heavier and bigger than the lateral condyle. The lateral condyle is more in line with the femur shaft as compared to this one, and that is the reason it has more role in weight transmission of the body. Lateral, even smaller, but still it is more weight bearing. Then each condyle has an elevation on here and elevation here. This is known as epicondyle. So lateral condyle, lateral epicondyle. Medial condyle, medial epicondyle. Good? Visible?
Yes. Where is the lateral division? Lateral epicondyle?
This lateral condyle, this elevated part is lateral epicondyle. Here. Epicondyle.
Where is the rest?
This all is condyle.
Yes.
Any elevated part here is epicondyle. Similarly, this all is condyle with elevated part epicondyle. Good? The two condyles are separated with this notch, intercondylar notch or intercondylar fossa. Okay? Plus, we have a line here, intercondylar line, which separates the notch from the popliteal surface. This is the line. Then here also we have two surfaces. One is for articulation of patella. So this is known as patellar surface. Then we have tibial surface of condyles. So patellar surface of condyle and tibial surface of condyle. Why I'm saying, okay, let's demarcate them with a color. Now life is good. So this line area here is actually the patellar surface to articulate with the patella, and the other surface is known as tibial surface for making knee joint with two condyles of tibia. Tibia similarly have two condyles, resting one. They are shallow, but still we have mechanisms. We will show you when we will do the joints. On the lateral condyle, we have a groove here, separating its tibial surface from epicondyle here, popliteal groove for the tendon of popliteus muscle. I make it a green line, popliteal groove. Another important feature related to medial condyle, rather the line joining the medial condyle, here we have a adductor tubercle. Adductor magnus is a big muscle here. It has multiple attachments. One of the attachment is here. Do you know adductor hiatus? An opening here.
Yes.
Adductor hiatus is also known as hiatus magnus. We have different openings in the adductor muscle. The biggest one is approximately at this level, adductor hiatus. Here we have femoral triangle. After femoral triangle, I'm just giving you an overview for the next. Here we have a femoral triangle. How we have femoral triangle? Here we have inguinal ligament. So one of the boundary is inguinal ligament, one of the boundary is here, one of the boundary is here. So we have femoral triangle. Femoral triangle will enter into another subsartorial canal, the apex, and it will end into this opening, hiatus. So the blood vessels, like for example femoral artery, external iliac, then it will become femoral, in the triangle, in the canal, hiatus, go down. From here it will come back to the popliteal surface, and after that it is known as popliteal artery until we reach the different destinations. Am I clear?
Yes.
Okay. Regarding patella, if you want to just find how the patella is there,